Welcome to another deep dive. I love it when we get a real mixed bag of medical topics. And this one is, well, it's quite a collection. We've got low back pain, amputation, urolithiasis, seizures.
Oh, and don't forget the medications.
Right. Gabapentin, benzodiazepines.
Even touched on Parkinson's disease.
It's like you're trying to get a panoramic view of the human body and all the things that can go right or wrong with it.
Maybe they are.
Yeah, maybe for personal knowledge or maybe to help someone they know.
Could be both. Either way, it's a great set of topics to dive into.
I gotta admit, prepping for this one, I fell down a few rabbit holes myself, especially with that phantom limb pain. It's wild.
It really is. It makes you think about how much we still don't know about pain.
Exactly. Like, how can you feel pain in a limb that's not even there?
The brain is a mysterious place.
And then the whole concept of a drug holiday for Parkinson's patients, that one really piqued my curiosity.
It's a fascinating approach. We can definitely unpack that later.
Yeah, let's put a pin in that one for now. But where should we start? I mean, there's a lot to cover here.
Well, how about something many of us can relate to? Low back pain.
Oh, yeah. Everyone's got a backstory, right?
Literally. And the crazy thing is, there are so many risk factors.
I was surprised by the sheer number of things listed, everything from heavy lifting to wearing high heels.
It really makes you think twice about those fashion choices.
Seriously. Our poor spines.
Yeah, and it highlights the importance of a thorough assessment when someone's experiencing back pain.
So more than just asking where it hurts.
Oh, absolutely. Just observing someone's posture and how they walk, their gait, can reveal a lot about their spinal health.
Really? Like what?
Well, for instance, a limp or a stiff posture could be a telltale sign of underlying issues.
Huh. Never thought about it that way.
And of course, we have our trusty imaging tools, x-rays, CT scans, MRIs.
Right. Got to get those pictures of what's going on inside.
Each technique has its own strengths, so choosing the right one is key.
So it's not just about popping a painkiller and hoping for the best.
Nope, not at all. The material emphasized physical therapy and personalized exercise plans.
Makes sense. You got to strengthen those back muscles.
Exactly. Think of your spine like a suspension bridge. It needs proper support and maintenance to function optimally.
I like that analogy. Okay, let's switch gears a bit now to something that honestly kind of startled me, amputation.
A bit heavier, yeah.
What surprised me was learning that a lot of amputations are actually elective.
It's not always an emergency situation.
Yeah, and often it's because of complications from diabetes.
It's a stark reminder of how diabetes can really wreak havoc on circulation, especially in the extremities.
So the blood just can't get to those areas.
Not effectively, no. And when tissues don't get enough blood flow, they start to die. And that's when things can get really dangerous.
Infection sets in.
Exactly. It can spread rapidly, and sometimes amputation becomes necessary to stop that spread and save the person's life.
Wow. It's a tough decision, I'm sure.
Absolutely. It's a last resort, but sometimes it's the best option for improving quality of life.
And then there's the whole phantom limb pain thing, which honestly sounds kind of freaky.
It's one of those things that really makes you question what we know about pain.
Right. How can you feel pain in a limb that's not even there?
Well, it all boils down to how our brains are wired. Even when a limb is gone, the neural pathways associated with it can still be active.
So the brain is still sending those pain signals even though there's nothing there to receive them.
Pretty much. And to make things even more complicated, traditional painkillers, like opioids, often don't work very well for phantom limb pain.
Why is that?
Well, because they target a different pain pathway than what's at play here.
So you need something that specifically targets those rogue nerve signals.
Exactly, and that's why doctors often turn to medications like beta blockers, anticonvulsants, or even antidepressants.
Antidepressants, really?
Yeah, they can actually be quite effective in modulating those specific nerve signals that are going haywire.
Huh, never thought about it that way. The sources also mentioned a specific wrapping technique after surgery, the figure 8 method.
Right, that's crucial for controlling swelling and shaping the residual limb.
Residual limb? I noticed they use that term instead of stump.
There's a reason for that. Stump can feel dehumanizing, like you're reducing someone to just their medical condition.
I see, so it's about respecting the individual's wholeness?
Exactly. It's a subtle but important shift in language.
Makes sense. Okay, let's move on from pain for a bit. How about we talk about kidney stones?
Urolithiasis, yeah. Those are definitely no picnic.
The sources said that the most common cause is simply dehydration.
It's a great reminder to stay hydrated, folks.
Yeah, drink your water. But seriously, who knew something as simple as not drinking enough water could lead to such excruciating pain?
It's all about keeping things flowing in the urinary tract. When you're dehydrated, your urine becomes more concentrated, which increases the risk of those minerals crystallizing and forming stones.
Oh, that makes sense. But dehydration isn't the only culprit, right?
Nope. Diet plays a role too. Certain foods can increase your risk.
Like what?
Well, for example, if you have gout, you're more likely to form uric acid stones.
Interesting. And even something as seemingly harmless as taking too many calcium supplements can backfire.
Yeah, it can increase your risk of calcium oxalate stones.
It's all about balance, huh?
Exactly. But yeah, Staying well hydrated is a simple yet powerful way to prevent those kidney stone woes.
I'll drink to that. Now, speaking of pain, the sources mentioned renal colic, and it didn't sound pleasant.
A renal colic is no joke.
What does it feel like?
Imagine the worst crapping pain you've ever experienced in your back or side, often radiating down toward your groin.
Ouch.
Yeah, it's caused by the stone trying to pass through the narrow urinary tract, basically stretching and irritating the walls as it goes.
No wonder people say it's one of the most excruciating pains imaginable.
It's definitely up there, and when the pain gets really bad, they might do a procedure called lithotripsy.
Lipo what?
Lithotripsy is pretty cool, actually. They use shock waves to break up the stones.
Shock waves. Like a sonic boom inside your body.
Kind of, but they do it very carefully using imaging guidance to target the stone precisely.
How do they make sure they don't damage anything else?
Well, that's where the monitoring comes in. One of the unique things about lithotripsy is that they time the shock waves to coincide with the patient's heartbeat, specifically the R wave on the EKG.
That's incredible. So they're basically synchronizing the shock waves with the heart's rhythm.
Exactly. It helps to minimize damage to surrounding tissues by delivering the energy bursts when the heart is in a specific phase of its cycle.
Wow, that's some high-tech stuff. Okay, I think we need a break from all this pain talk. How about we switch gears to something a little less, visceral?
Sounds good. Where to next?
Let's dive into seizures. I know it can be a bit of a confusing topic. So first off, can we clarify the difference between a seizure and epilepsy?
Sure, a seizure is a single event. It's a sudden surge of electrical activity in the brain, kind of like a brief electrical storm.
Okay, so it's like a one-off thing?
Right. Epilepsy, on the other hand, is a chronic neurological disorder characterized by recurrent seizures.
So if you have one seizure, it doesn't necessarily mean you have epilepsy.
Exactly. It's the pattern of recurrent seizures that leads to a diagnosis of epilepsy.
That makes sense. And there are different types of seizures, right?
Oh, absolutely. Not all seizures are created equal. They can be broadly classified as generalized or partial.
Okay, break that down for me.
Sure. So generalized seizures involve both hemispheres of the brain, like a widespread electrical surge.
So the whole brain is affected.
Right. A classic example is a tonic-clonic seizure, also known as a grand mal seizure.
I've heard of those. They sound pretty scary.
They involve loss of consciousness, stiffening of the body, and then rhythmic jerking movements.
Yikes.
Partial seizures, on the other hand, originate in a specific area of the brain, like a localized electrical disturbance.
So just a part of the brain is affected.
Exactly. And these can manifest in various ways depending on which area of the brain is involved.
So someone having a partial seizure might not even seem like they're having a seizure.
That's right. They might just experience brief periods of confusion, staring spells, or unusual sensations.
Huh. Interesting. And a little bit unsettling, to be honest.
Yeah, it can be tricky to recognize. Sometimes they might even have involuntary movements of a limb or changes in their perception.
It really depends on what part of the brain is acting up.
Exactly. Like each part of the brain has its own unique set of symptoms when things go awry.
Fascinating, but a little scary to think about. Now, I know there's a particularly dangerous type of seizure called status epilepticus, right?
That's right. Status epilepticus is a medical emergency.
What makes it so dangerous?
Well, it's essentially a continuous state of seizure activity, either a single seizure lasting longer than 5 minutes or repeated seizures over a 30-minute period without the person regaining consciousness.
So their brain is basically stuck in seizure mode.
Pretty much. And that can lead to brain damage and other serious complications.
So what should someone do if they see someone having a seizure? I mean, it sounds terrifying. I wouldn't even know where to start.
The most important thing is to stay calm and remember that your goal is to keep the person safe.
Okay, so don't panic.
Right? Don't try to restrain them or put anything in their mouth.
That's just an old wives' tale, right?
It is, and it can actually cause harm.
What should you do instead?
Gently roll them onto their side. This helps to keep their airway open and remove any objects that could pose a hazard.
So basically clear the area and make sure they can breathe.
Exactly. And then call 911 immediately, especially if a seizure lasts longer than 5 minutes or if the person doesn't regain consciousness afterward.
Got it. So stay calm, keep them safe, and call for help.
You got it. And remember, there's usually a recovery period after a seizure.
Oh, right. The post-nipple phase, I think the sources called it.
Exactly. During this time, the person might be confused, disoriented, or just plain exhausted.
It's like their brain needs to reboot after that electrical surge.
That's a good way to put it. It's crucial to let them rest and recover in a safe environment during this time.
Okay, makes sense. Now, all this talk about seizures makes me think about those medications you mentioned earlier, like gabapentin, benzodiazepines, and barbiturates.
Right, they all play a role in managing seizures and other conditions.
I know they have different uses, but what are some of the common things we should know about them?
Well, one key thing is that they all belong to a class of drugs called central nervous system depressants, or CNS depressions for short.
What does that mean exactly?
It means they slow down brain activity, which can be helpful for treating things like anxiety, seizures, and insomnia.
But slowing down brain activity sounds like it could also have some downsides, right?
It can. One of the biggest concerns with these medications is that they can cause drowsiness, dizziness, and impair coordination.
So you probably shouldn't be operating heavy machinery after taking them.
Definitely not. And of course, there's the big one. They absolutely should not be mixed with alcohol.
I was just going to ask about that. Why is that so dangerous?
Well, alcohol is also a CNS depressant, so combining it with these medications is like doubling down on that slowing effect.
And that can lead to
Slowed breathing, loss of coordination, confusion, and in severe cases, even coma or death.
Yikes. Okay, so mixing those meds with alcohol is a big no-no.
Absolutely. It's crucial to avoid alcohol completely while taking these medications.
Got it. Now, for our listeners playing along at home, what's the antidote for a benzodiazepine overdose?
Ah, good question. The antidote is flumazenil.
Flumazenil, got it. But I'm guessing that's not something you should try administering at home.
Definitely not. It should only be given by a healthcare professional in a controlled setting.
Makes sense. Okay, one last thing about medications before we move on. The sources mention that most drugs are processed by the liver and eliminated by the kidneys. Why is that important to know?
Ah, because it highlights the interconnectedness of our organs and how one system can impact another. If someone has liver or kidney problems, it can affect their ability to process and eliminate medications.
So the drugs could build up in their system.
Exactly, which can increase the risk of side effects or even toxicity.
That's why regular checkups and blood tests are so important, especially for people taking medications long term.
Absolutely. It's all about making sure those organs are functioning properly and keeping things in balance.
Okay, I think we officially covered the pharmaceutical landscape for now. Let's move on to our final destination for this leg of our deep dive. Parkinson's disease.
A fascinating and complex condition.
For sure. And to understand it, we need to start with the basics. The sources mentioned an imbalance between two neurotransmitters, dopamine and acetylcholine.
Right, they're like two dancers in a carefully choreographed routine. Dopamine is involved in regulating movement, while acetylcholine helps with muscle activation.
So they work together to make our movements smooth and coordinated.
Exactly. In Parkinson's disease, there's a progressive loss of dopamine-producing cells in a specific area of the brain called the substantia nigra.
And that throws off the whole routine.
Precisely. This loss of dopamine leads to an overactivity of acetylcholine, which disrupts that delicate balance.
So it's like one dancer is fading out while the other is trying to overcompensate and the whole routine falls apart.
I like that analogy. And this disruption manifests in the classic symptoms of Parkinson's disease.
Which are?
Well, there are 4 cardinal signs. Tremors, which is that involuntary shaking, often starting in the hands.
Okay, tremors, got it. What else?
Muscle rigidity, which is stiffness. Bradykinesia, which is slowness of movement. And postural instability, which can lead to balance problems and falls.
Wow, that's a lot to deal with. And I remember the sources mentioning a mask-like face. What does that look like?
It's basically a reduced range of facial expressions, as if their face is frozen in a neutral position.
So they might appear expressionless or unemotional, even though they're not?
Exactly. It's another consequence of that disrupted dopamine-acetylcholine balance affecting the muscles involved in facial expressions.
It's amazing how such a subtle imbalance can have such profound effects on movement and expression. Now, the sources also mentioned that there's no single test to diagnose Parkinson's, so how do doctors figure out if someone has it?
You're right, there's no blood test or imaging scan that can definitively say, yep, you have Parkinson's.
So how do they make the diagnosis?
It's primarily based on clinical presentation, meaning the doctor observes the patient's symptoms, takes a detailed medical history, and conducts a thorough neurological exam.
So it's a lot of observation and piecing together clues.
Exactly. It's like being a medical detective. And while there's no single definitive test, certain imaging studies like MRI and DAT scans can help rule out other conditions and support the diagnosis.
So it's about gathering as much information as possible to make an informed diagnosis.
Precisely. It's a complex process, but experienced neurologists are very good at recognizing the telltale signs of Parkinson's.
That's reassuring to know. Now, I know there's a lot to talk about when it comes to treatment options for Parkinson's.
We could do a whole deep dive on that alone.
Right. We've got medications, therapies, even medical marijuana to discuss.
Maybe we should save that for the next part.
That's a great idea. We've covered so much ground already. It's time for a little break.
Agreed. Let's recharge and come back ready to tackle those treatment options head on.
Sounds like a plan. See you soon.
All right, welcome back to the deep dive. I feel like we left off on a bit of a cliffhanger, all geared up to explore those Parkinson's treatments.
We did, didn't we? And there's a lot to unpack there.
For sure. But before we go there, something that really struck me from our last chat was just how often lifestyle factors came up. Like, With low back pain, we talked about how obesity and bad posture can make things worse.
It's a recurring theme for a reason. Our everyday choices really do have a huge impact on our health.
And we saw it again with diabetes and the risk of amputation.
Right, and with kidney stones and the importance of staying hydrated, it all ties back to how we treat our bodies.
It's almost like a domino effect, One seemingly small choice can have these cascading consequences.
Exactly. It's all connected. It's a dynamic process, this whole health thing. Our bodies are constantly adjusting and responding to what we throw at them.
That's a good point. Okay, so let's dive into those Parkinson's interventions. The sources mentioned a medication called carbidopa-levodopa.
Ah, yes, the dynamic duo.
Dynamic duo. That's what I call them. They work together. They're both crucial for managing Parkinson's symptoms.
Okay, so break it down for me. How does this combo work?
Well, remember how we talked about Parkinson's being linked to low dopamine levels?
Yeah, that was a key takeaway.
Right, so levodopa is a precursor to dopamine, meaning it can be converted into dopamine in the brain.
But wait, didn't we also say that dopamine itself can't cross the blood-brain barrier, that protective shield around the brain?
We did. And that's why we need levodopa. It can actually sneak past that barrier.
Sneaky. So levodopa is like dopamine in disguise.
You got it. It gets into the brain and then transforms into dopamine.
That's pretty clever, but what about carbidopa? Where does that fit in?
That's the bodyguard. Carbidopa prevents levodopa from being broken down before it reaches the brain.
So it makes sure levodopa gets to where it needs to be.
Exactly. Without carbidopa, much of the levodopa would be metabolized before it could even get to the brain.
So they're like a tag team working together to deliver that dopamine boost.
Precisely. It's a remarkable example of how medications can be designed to overcome biological obstacles.
It really is. Okay, now let's shift back to seizures for a moment. The sources stress the importance of carefully watching what happens during a seizure and documenting everything you see. Why is that so important?
It's all about gathering clues, like a detective at a crime scene. You want to know every detail, your length of the seizure, the specific movements or behaviors you see.
Anything out of the ordinary.
Exactly. Changes in color, breathing patterns, anything and everything. This info is crucial for the medical team.
So it helps them figure out what type of seizure it was?
And then determine the best course of treatment. Your observations can make a huge difference in getting the right diagnosis and treatment plan.
Wow, I never realized how important that was. It's more than just calling for help. It's about being an active observer.
Exactly. Your role is crucial. You're the eyes and ears for the medical team.
Got it. Okay, one last thing before we move on. The sources highlighted the importance of family teaching for many of these conditions.
Absolutely. It's all about empowering patients and their loved ones to be active participants in the healthcare journey.
So what does that involve?
Well, it could be anything from explaining medications and their potential side effects to teaching techniques for managing symptoms, connecting them with support groups and resources.
Making sure they have all the tools they need.
Exactly. It's about recognizing that healthcare extends beyond the doctor's office. It's about equipping families with the knowledge and support they need to navigate these challenges.
It takes a village, as they say.
It really does. And family teaching is a vital part of that village.
I love that analogy. Okay, I think that about covers it for this leg of our medical deep dive.
We've explored some fascinating territory today.
We have, and I'm sure there's still much more to discover, but for now, let's take a moment to appreciate how far we've come.
Agreed. We've gained valuable insights into a wide range of conditions.
And I, for one, am feeling much more informed and empowered to navigate the world of health and healthcare.
As you should be. Knowledge is power.
Absolutely. Wow, we've really journeyed through a whole medical encyclopedia, haven't we? It's amazing how much we've covered in just a few deep dives.
It's true. We've really hit on some key areas. And what's fascinating to me is how it all ties together. How one condition can impact another and how our choices, our lifestyle, can play such a big role in our overall health.
Yeah, it's like a giant web, everything connected.
Exactly. And I think that's one of the biggest takeaways from all of this. It's not just about treating individual symptoms. It's about understanding the whole picture.
The whole person.
Right. Mind, body, and spirit.
I like that. And one thing that really stuck with me was that little tip about urine color as a hydration gauge. I've been checking mine constantly ever since our kidney stone discussion.
I love that. It's those simple, practical things that can make a real difference.
It's so easy to forget to drink enough water, But now I have this visual reminder, and it's really helped.
It's those little nudges that can sometimes be the most effective.
Speaking of nudges, I keep thinking back to what we talk about with early detection.
It's crucial, isn't it? The sooner you catch something, the better the chances of successful treatment.
Like with Parkinson's, it can take years for the symptoms to become really obvious.
That's right. So it's really important to pay attention to any changes in your body, even if they seem small.
Don't ignore those subtle signs.
Exactly. Get things checked out and don't be afraid to advocate for yourself.
Especially if you feel like something's not right.
Absolutely. You know your body better than anyone. Trust your instincts.
And sometimes those instincts lead you to seek out specialized care, right?
For sure, not all healthcare providers are created equal. And sometimes you need someone with specific expertise.
Like with phantom limb pain, we talked about how those traditional painkillers often don't work.
Because it's a different kind of pain, a different mechanism at play.
So you need a specialist who understands that and who's willing to try different approaches.
Exactly. Someone who's up to date on the latest research and treatment options.
It's all about finding the right fit for your individual needs.
Absolutely. Healthcare is not one size fits all. It's about personalized care and finding what works best for you.
And sometimes that involves thinking outside the box.
Oh, definitely. Like using antidepressants to manage chronic pain, for example.
That one really surprised me.
It just goes to show that our understanding of the brain and pain is constantly evolving. What might seem unconventional today could be the standard of care tomorrow.
It's exciting to think about all the possibilities.
It is, and it's a reminder to stay open-minded and curious about new developments in healthcare.
To always be learning.
Exactly. Because knowledge is power, and when it comes to your health, you want to be as empowered as possible.
I couldn't agree more, and I think that's a perfect note to end on. This deep dive has been a true testament to the power of information and the importance of taking an active role in our well-being.
It's been a privilege to explore these topics with you, and I hope our listeners feel inspired to continue learning, asking questions, and advocating for their own health.
Well said. Thank you for joining us on this incredible journey of discovery. Until next time, stay curious and stay well.